I love this program. It's so good. It's brilliant. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today we are going to be doing something a little bit different. I feel like I always say that in my videos, but anyway, we are going to be watching some episodes of My Family, specifically the dental scenes, and reacting to them and seeing how realistic they actually are. I know that My Family is quite an old program, so a few things probably would have changed by now. I feel like My Family in its day was probably one of the best British sitcoms. I loved it. I watched it all the time. It's brilliant, and if you've never seen it, I highly recommend going to watch it because it was a great program. Unfortunately, the whole thing isn't like a dentist program, and I've been racking my brains trying to think of programs that I can react to and watch for you guys and, you know, compare them to real life dentistry, but this is the only one I can think of. Somebody did suggest to me the Mr. Bean episode, so I might do that one. And if you guys have any suggestions for things that I can watch and compare to real life, then pop them in the comment box and I will make sure I do that. I am very not prepared for this, and I haven't even YouTubed to see if they're actually on there, but I'm hoping they are, specifically the dental scenes. We'll see. Anyway, if you would like to see me watch this, compare it, and see if it's anything like real life, then just keep watching. Okay, so I'm sat this side because I need this space on the screen to be able to show you the video and, you know, react to it. I have just spent the last like 20 minutes trying to find My Family online. It's not on YouTube. It's not on Netflix. It's not on Amazon Prime. I couldn't find it anywhere. Eventually, I have managed to find season 1, episode 2. I can't find episode 1 anywhere. It's disappeared off the face of the earth. But never mind, we are here. We are ready for season 1, episode 2. I'm going to try and skip to just the dentist bits because I'm sure you don't want to see me reacting to, you know, the bits with the family, even though that makes it hilarious. Let's just crack straight on with it.
Okay, Mr. Fisher, and bite down, please. Very good. Bridget, kidney dish. Well, that's lovely. So, what did you do at the weekend?
Okay, so already I can kind of tell it looks quite realistic so far. Not quite sure what he's having done. Well, obviously impressions, the patient. Everything looks good so far. Do vaguely remember the days of fish tanks in the dentist office. I can't remember them being in the surgery. I just remember them like in the waiting room. Is that really ethical to have a fish tank in a dental surgery? Probably not, but you know, this is going back quite a long time. I mean, it looks good so far. The only thing that I would say, obviously I know it's a comedy and they have to, you know, exaggerate things for effect. In real life, if the dentist asks you for something and you're refusing to give it to them, don't think you'd get away with it as easily as this nurse is. Never mind, let's carry on.
Really? Yeah, I know. And I've heard it can be quite expensive. Me? Oh, I had a weekend of my dreams. Marvellous weekend down at the DIY superstore. Loads of fun there, yeah. Dragging a sulky teenager up and down the aisles, trying to get them interested in home decorating. Yeah. I often wonder where they get the staff from. And the prices. Any chance of that kidney dish before I retire? See these? 18 quid they cost me. I know, that's what I thought. All they do is cut tiles. Kidney dish.
You can have the kidney dish when you apologise.
Mr. Fisher, have you met my part-time assistant? Funny thing is, I'm
trying to establish things in the surgery that aren't quite right, but actually they've done a really good job of it. It's pretty accurate surgery.
paying her full-time. All right, I'm very sorry that I said you had the memory of a retarded glove puppet. But for the record, it doesn't change the fact you've been forgetting to pass on my messages.
Oh, don't take it out on me just because you've got trouble at home.
Well, I haven't got trouble at home.
I forgot. Your wife rang, there's trouble at home.
Okay, so at the minute all looks good so far. There's nothing really that I can think that's out of place or out of the ordinary. Also, I'm just going to apologise for the picture. This is a very old well, the first episodes were fairly old. At the minute, so far, all seems great. Let's skip to another dentistry scene.
Scaler. All right, I'm sorry I said Celine Dion sounded like a cat trapped in a dog's home.
Okay. The only thing that I have just noticed is, why is the nurse on the dentist's side? The nurse has a side and the dentist has a side, so everything on the nurse's side she would pass over. So I'm not sure why she stood on the dentist's side and not around the other side to be ready to do anything that might need to be done. That's the only thing I'm seeing so far. Actually, I've just noticed, why is the light so far away from the patient? I mean, they've done the lighting quite well because you can actually see the beam of light on the patient's face, but in real life that realistically wouldn't happen. You need the light a lot closer, and the light is a lot closer in real life.
She does though, doesn't she?
No surgery. He's with the patient at the moment. Yes, I could take a message, except he'll only ignore it, Mrs. Harper, and pretend I didn't pass it on.
Hello, darling.
There we go. Don't know if anybody else just saw that, but when the nurse answered the phone, she took her glove off. Brilliant. You don't want to be touching a phone with a dirty glove. But Ben has just taken the phone with a dirty glove. First of all, that's a massive no-no. Do not touch anything with the dirty glove. But second of all, are they going to wipe that phone before they then put it back on the holder? Let's see.
It's Michael.
What is it now?
It's a bit difficult to describe.
Well, how serious is it on a scale of 1 to 10?
14.7.
I think we have to report this to the school.
I've already tried, but it was closed. I'll have to call again on Monday.
And this was what was stuck to his back?
Yes. What's happening to our schools?
Okay, just do quickly skim over again. It's not great that the dentist has taken personal calls while in the surgery in front of a patient. That is obviously his personal life, and calls shouldn't be coming through to the surgery on a personal point of view. I appreciate that she's saying like it's an emergency. So if there genuinely was a real emergency in real life where the dentist needed to be informed and go home, so you've got an internal phone system. So in a real emergency, you could buzz and, you know, say, look, there's an emergency. The dentist needs to stop or finish with his patient and then go. And then I'm sure the dentist would obviously then speak to the receptionist and find out what happened. But generally, the dentist necessarily wouldn't take a personal call like that with a patient in the chair. They might. I could be wrong. So if you have personally experienced that, then let me know. But I would probably say that the nurse would take the call and then inform the dentist, so he can then make the decision whether he wants to take the call or not. So let's skip to another dentist scene. There's not many dentist scenes, to be honest. That was it for episode 2. Pretty much everything was fine as it should be. There were a few little things, but remember, like I said, this is an older program, so maybe those kind of rules and regulations weren't put in place then. Just going off of what they are now, that's what I noticed about that particular surgery. So let's go on to episode 3.
Do you know who that is?
No, in the chair, Bridget? I don't actually know. Hey, 1 minute I turn my back, the next minute, there he was. Bang! Sprung up like a fungus. That's how I get all my patients.
He is Lord Whitton, champion of organic farmers everywhere.
Whereas to me, he's simply lost filling with a receding gum line and breath that could kill a horse.
As usual, Mr. H, you seem to be missing the point. Lord Whitton's All Natural England Gala was featured on page...
Okay, I don't know why I didn't notice this in the last episode, but her hair is down and it's long. You're not allowed to have your hair down, especially if it's that long, in the surgery. She should have to have it tied back and out of the way. You know, if you're suctioning on a patient, your hair is going to be moving forward, probably going to be going in the patient's face, especially at that length, because you're kind of inches away from the face. So that's definitely something that they should have done, is tied her hair up to make that a little bit more realistic.
Of this week's Hello.
And as usual, Bridget, you seem to be missing the point that time, whilst generally cruel and mocking, is also money. And as we have 2 regular scheduled patients outside in the waiting room, and your job is dental assistant, assist me. Okay. Right, we'd like to sit back and relax.
Yes. Kind of your assistant to fit me in at such short notice. Very efficient young girl there.
Really? Did you give him Novocaine or gas?
You see, we've been up in London for this soiree thrown by the missus, and I lost a filling in a devilled egg.
I'm actually really glad that he said it was kind of your assistant to fit me in at short notice. Dentists don't take the call, you know, when a patient rings up and says they're in pain. But I have never ever heard a patient in real life thank the nurse for fitting them in. They always thank the dentist, and of course it is absolutely the dentist's time. Well, it's the nurse's time as well, actually. And a lot of the time, it is the nurse that would take the call and say, you know, put them in here. So I'm really glad that they added that feature in of the patient thanking the nurse.
Undoubtedly from a battery hen. They get depressed in cages, you see, and lay eggs like rocks. So, I called around for assistance, and you came up highly recommended.
Really? Well, it's always gratifying to be recognised in one's field.
Yes, just around the corner and cheap.
Yeah. Well, very flattering.
Yeah, no, that's important. Just because I have a title doesn't mean I'm made of money. Everyone always asking for something. Snivelling little vultures, you know what I mean?
I know what you mean. I've got 3 children.
Oh!
Okay, so I'm just going to judge by what he said that they operate their practice as an emergency sort of clinic. So they'll have their regular patients, but they're happy to take patients off the street, because he's obviously not a regular patient, because he's just said you would just round the corner and cheat. And a regular patient wouldn't be saying that. I'm going to speculate that they are some sort of emergency clinic from that. And also, this is actually so true. A lot of patients will start telling a story and they just won't stop talking, and you're sat there like, next one's due in 10 minutes and we haven't even started yet.
Start me on children.
I didn't think I started. Did you start him on children? No, let's begin, shall we?
No, you see, my son's with us in London on holiday.
Ah, well, I'm sure you'd love me to get a move on so you can rush back to his side.
No, I don't. He's at one of those arty schools. The wife's a big believer in arty. Even the girls are arty. Hair growing everywhere, legs like grizzly bears. Horrible creatures, you know what I mean?
So, shall we carry on? If you'd like to open wide and try not to let any words escape.
Can I just say, Lord Whitton, that I was deeply, deeply moved by your pamphlet on the recycling of fecal waste.
Really?
Yeah.
Now you see, this is the sort of gal my son should be meeting. Solid, natural.
Are we still talking fecal waste?
So, my dear, is 17 too young for you?
Oh, I'm sorry, Lord Whitton, I'm actually celibate this cycle.
Far too much information, guys.
No, you misunderstand. It's purely innocent. Nothing about sex.
Oh, then what's the point?
Right, anyone else hungry, or shall we call out for sandwiches?
Mr. Harper has a daughter.
No, I don't.
Yes, you do. Janie's charming.
You don't live with her.
Is she a normal teenage girl?
Well, that's a contradiction in terms.
No. I mean, does she have a pierced eyelid?
No.
Does she have nails in her neck?
Not yet.
Has she clipped her personal topiary into the shape of a duck?
I just hope I never find out.
Splendid. Right. Do you mind if I ask my son to give her a call?
Well,
Yeah? Yes, jolly good. All right, you can carry on now.
You did what?
It wasn't my idea, for God's sake. It was Bridget's.
Oh, that's right. Deny all responsibility.
I tried that when you were born. Didn't work.
Oh. Well, you might think this is funny, but you've completely ruined my life.
Who was that?
Okay, so apart from the stuff I've said, it's pretty accurate at the minute. Patients do like to have a good natter, and I do get it, because obviously they're only seeing the dentist like once or twice a year, but the dentist is seeing patients constantly. And do you know what? Whenever I come home from work, I just don't want to talk to anyone, because I've spent the entire day talking. First of all, my brain needs a rest from talking, but my mouth needs a rest from talking, and I need to take a break from listening for a while and just kind of cool off and, I don't know, just be on my own for maybe 10-15 minutes when I get in from work. So that was quite accurate with a patient. Just keep talking whenever you try and start something. Like I said, the nurse's hair shouldn't have been down, that needed to be up. I mean, she had her mask, I don't know if you saw, but it was like wrapped in the hair, and that's obviously not great. It doesn't look professional. That hair should have been up. Let's find another dental scene.
You're never going to guess who's in the waiting room.
Correct.
Well, if you're not going to try, I'm not going to tell you.
Good.
Lord Whitton's son.
What?
Apparently he broke his tooth on something.
Yes, my daughter's bra strap. Wait a minute. That boy tried to assault my daughter, Janie.
Okay, so I don't know whether they used to do this in real life. Certainly now there would definitely not be a hole in the door because anybody, any patient could just look in and see what was happening. And if they were very, very good, they can maybe lip read and then find out some personal information. So obviously that's taking it a bit far, but there shouldn't really be a glass hole in the door for people to look through. So that's something that's not quite accurate.
How could you let her go out with him? Maybe I should call it off my support.
No, don't do anything ever again. Oh my God, I promised not to say anything, and there I go telling you.
Well, you couldn't help it. Most men crack under the pressure.
Okay, again, hair down, but she's also got really dangly earrings in. She definitely shouldn't be wearing that kind of jewellery. They need to be studs in the ears. It's not professional. It doesn't look right. Save that kind of jewellery for going out. Just wear studs in the ears when you're nursing.
A wily interrogation.
You only said what?
I know. It's uncanny, isn't it?
Send in the patient. Oh, but you're a professional. You took an oath. Senor.
Thanks for seeing me.
Actually, I'm surprised to see you.
Oh, believe me, I didn't want to come. But Father insisted. And you know Father.
Oh, yes. So, you have something to tell me?
Well, yes. Can we get a move on, please? I'm in a hurry.
So, are we in much pain?
No.
We'll soon see about that. So, if you'd like to open wide, we'll have a little look, shall we?
Okay. Red flag. Has anybody else noticed he hasn't got gloves on? Why is he going into a patient's mouth without gloves on? Oh, I can't remember how long ago it was, but some dentists trained without gloves. But I don't think this was made as long ago for him not to wear gloves. It may have been. I'm not entirely sure what year the gloves kind of came in, but he was wearing gloves in the previous scene, so he should be wearing gloves certainly in this scene. So that's a massive red flag. And I've also just seen he's got a watch on, which they shouldn't be worn by nurses or dentists. So the only jewellery you're allowed to wear is studs in the ears and a marriage ring. Any other jewellery, bracelet, any other rings, watches, they shouldn't be worn.
Now, does this hurt? Ah! Good. Yes, we've got a broken incisor. We're going to need 10 cc's of Novocaine.
A broken incisor? But I thought he was, that didn't seem quite accurate. And he's holding this part of his face. An incisor is one of the front teeth, not one of the back teeth, but he's just prodded one of the back teeth. So that wasn't accurate at all. Not quite right there.
Bridget. So, I bet you have a really wild story about how this happened.
Well, vaguely. I was getting stuck into a rather bony little chicken.
Bony little chicken.
Yeah. It's a tough little bird. Not quite the quality I'm used to.
Right. Bridget, syringe, please.
But you know Father, with all his blah-de-blah-de-blah about natural, solid and plain. And he calls the shots.
No, I'm afraid at the moment I call the shots. Now, if you'd like to open wide, this won't hurt a bit. Ah!
Just noticed as well, earlier on, the nurse and the dentist were the other sides, and this wouldn't happen in real life. They wouldn't be swapping sides. Sometimes the dentist will need to go the other side to do an injection, but generally the nurse, you know, will stay on her side. That's not quite accurate for the dentist and the nurse to swap.
Begin, shall we? Thank you. Right, it's showtime. Right, are we numb yet?
No, you haven't given me my Novocaine.
Ah, good. So, are we numb now? No! Are you crazy?
I mean, apart from like the torture element here, he hasn't got a bib on, he hasn't got glasses on, the dentist hasn't got gloves on, the nurse is squirting the 3-in-1 tip everywhere. This whole scene, okay, I completely understand. It's, you know, comedic effect, it's just funny, and it is genuinely funny, but there are a lot of inaccuracies, especially with PPE.
Don't you understand the word no?
Me? Didn't you understand the word no when my daughter said no?
What is he talking about?
Don't play games with me, Toby.
I'm not Toby, I'm James.
You who?
I'm James. James, Toby's brother.
Your
Father never mentioned James.
Yeah, well, he never mentions me at all. I'm not natural enough for his all-natural England.
You don't eat organic?
No, I'm gay.
Gays don't eat organic?
Stop it!
Let me get this straight. This bony little chicken didn't mean my daughter.
No, it was a bony little chicken.
I am so sorry.
I am so confused.
It's enough I have to put up with my crypto-fascist father. I'm away from home, away from my friends. I don't know anyone in London.
I tell you what, James, Mr. Harper has a son.
You are really right. That was worth every...
Okay, I'm pretty sure that's it for the dentist. Yeah, that's it for the dentist scenes in that episode. That was really good. That was different and it was really fun for me to do to kind of compare it to real life. I'm going to go back to the center screen now. So what did you guys think of it? Did you enjoy it? Did you not enjoy it? Is it something you would like to see again? Would you like me to cover different episodes of things? Like I said, if you've got a suggestion, pop it in the comment box below and I can definitely cover it for you. For me personally, that was really fun to do. It was great to watch those episodes again. I know it wasn't the full episodes, but the dental scenes. And do you know what? It's really weird actually watching them now as a dental nurse. I mean, the last time I saw them, it was years ago. Most of the stuff was pretty accurate, the way the surgery was laid out, apart from the stuff that I obviously picked up on. But then again, this is an older series. So maybe the newer series, and they're not new, I think possibly the last series was like 2011 or something. So maybe I should watch some of them and compare them to nowadays, because that is obviously quite a few years old, as I'm sure you could tell from the quality of the picture there. Yeah, that was great fun and I would love to do some more of these for you guys. Anyway, I really hope you enjoyed this video today. If you did, please give it a big thumbs up. Click that subscribe button down below and then click the little bell next to it and that will notify you when I next upload, and I will see you in my next video. Bye!